I knew, right now looking back, I knew something wasn't right. So I walked out of the attic. I told Josh, I said, I'm going home. And I left him to clean everything up. I just got in the truck. I drove home. I was sweat from head to toe. Laid down on the couch for a little bit and thought I'll take a little break. She said, you really need to go. Why don't you go to the hospital? And of course I argued and said no. And we said, okay, we'll talk about it tonight. Hung the phone up, and she called back about 5 minutes later. And she said, hey, I've taken off work. I'm headed home. Your choices are I'll come home and get you, or I'll call 911 now. That's your choices. And I said, well, then I'll just go with choice 3. I'll drive and meet you at the hospital. So I got in the truck and I started up Walnut Street and to come to the hospital, and I knew it. I knew something wasn't right. It hurt. I went in, I pulled up to the front there, and I just parked my truck out in front of the hospital, went in and told him I was having, from Lisa working there, I remembered if you just tell them you're having chest pains. So I just said, I'm having chest pains. And they snapped into, before I knew it, I was back in one of the big rooms with all kinds of people around me.
If someone's having chest pain, our threshold for being aware of or looking for a heart attack is very low. We're always looking for that. So they're always looking for it. They do an EKG on anybody who has pain from the nose down to the pelvis. We're going to do an EKG, and if it shows a heart attack, then we're going to move on it. So the nurses, if they walk into the ER, they're getting EKGs within 5 minutes or less. They're showing it to me if I'm on duty, and if we see a STEMI, when we were on it. When I got here in 2011, there was no organized process for heart attacks or STEMI. And the door to balloon time, which is the time from the onset of the heart attack until they open the artery during a heart cath, that time, the gold standard is 90 minutes. That's the national standard. But our door to balloon time here was bordering on 200 minutes. After we reviewed the process, I wanted to implement with the hospital and with the hospital attorneys. It was determined we could go see patients in the ambulance bay and not move them into the hospital, because I thought that was a waste of time. And the old adage is time is muscle. So we didn't want to waste 15 minutes getting them into the ER and taking them out. So that's how we came up with this process, whereby if we're notified that there could be a heart attack and it's from an ambulance, we meet them in the ambulance bay. We look at the EKG. If we confirm that's what it is, then we literally jump in the back of the ambulance, examine the patient, get a brief history. We administer some medication, and then the patient is rolling out of the ER. And the time, I think, maybe takes 2 to 3, 4 minutes tops, and then they're on their way. And so our door to balloon time with our partnering facility is 60 minutes. If a patient walks in, the process is the same. We notify EMS, and then we do the same process. It just takes a little longer. But the door to balloon time is still well under the national benchmark. It's like 72 or 3 minutes. So we do a very good job of identifying heart attacks, implementing the treatment, and getting the patient to where they need to go. If you imagine that your heart artery is blocked and your heart muscle is not getting any oxygen, therefore it's dying, every minute that goes by is detrimental. So the faster we can get the patient to a facility where they can open the artery, the door to balloon time, and thereby restoring circulation, the less damage is going to happen. And if we do it fast enough, then sometimes there's no damage.
And I just remember being in the ambulance, pulling out of here, and Tammy had done an EKG. And about the time I heard her say, let's hit the lights and sirens and go. And I heard her say that. And about the time I heard her say that, I remember that's when I started feeling like something's wrong. It got real heavy on my chest. So there was a lot of protocols she went through to get me prepped. When I pulled into the cath lab, there was a bunch of people. I mean, come out, and I went straight into the cath lab and basically laid there and watched it. Watched him the whole time. He went in through my wrist, went up. I watched it all on the TV screen and watched him do it. And within 30 minutes, I was in my room, recovered. recovering, and then they did I had it was 100% blockage of the left anterior, which is the widowmaker.
Yeah, everyone takes it very serious whenever somebody comes in with chest pain. I mean, that is probably the fastest process that we'll do. So, and we've had a lot of people come back, and we've had employees' families come back that we've sent through here, and very appreciative of how fast that we were able to get them in and out and to the closest cath lab, and we did. I mean, we did save their life.
It's close. It's like
It depends on who's on the track.
Yeah, it's like a rolling
It is.
stop.
It's like a
at red
NASCAR
light.
pit stop.
or an IndyCar pit stop. I mean, everyone's in there. Everyone's doing their
Yeah.
thing, and then a minute or 2 or 3 and gone.
Be careful when you get out of the truck, because it might be going.
You know, I would say there's probably not a community hospital in a semi-rural setting like we are that can have these kind of statistics like ours. We're so well below the national benchmark. I just don't think a lot of places can achieve that.
Yeah.
I mean, it's amazing. Well, it's the reason I'm sitting here, right? Because if there's an hour, who knows, half hour, if there's 30 minutes in there that doesn't happen, if I sit in the emergency room down here for more testing, who knows what happens? Even if it's right, if you talk survival, even if it is, how much damage is done? Can I still work? That kind of stuff. So I was in the right place, the right time, with the right people in place.